Good morning. Good morning. Of course, my dog is going to go crazy as soon as we go live. Hang on just a sec. How are you guys? Come on. We're going live. Come on. Don't you want to say hi to everybody?
Oh my God.
Say good morning, crazy. Say good morning to everybody.
What's her name?
That's Emma.
Emma? Oh my gosh.
Yeah. She is my little emotional support animal, keeping me active and crazy.
Oh, Mick said anyone else's sound not working.
Uh-oh. Laura, can you hear me? Lindsay?
Here?
Can anyone hear us? I can hear you.
I can hear you.
Okay, good.
Okay.
All right, Michaela, you just gotta get your phone together, girl. All right. So how's everyone doing? How are you, Kenzie?
I'm having a miserable morning.
Oh.
Yeah, I was like, my stomach was not feeling good after I took my meds. And that sometimes happens. I take a lot of supplements because I obviously can't eat everything. And whenever I take my iron, sometimes I feel awful. And so I was brushing my teeth and I was in pain and I didn't feel good and I vomited everything back up.
Oh.
And it was just it's been a nasty morning, but I'm hanging in there.
And
Yeah.
she's here. She doesn't even look like she vomited.
Yeah. I don't know.
Yes.
This is good for me to be here.
Good.
How are you?
I am doing all right this morning. I told you that I woke up in a bunch of pain and was a grumpy gills and had to, turn my attitude around after I realized I was taking it out on my poor husband.
Yeah.
Uh, Here we are. I did a solo dance party.
I
I,
love it so much.
I Britney Spears really has something going on, people. I mean, honestly, I'm a huge Britney fan. I'm just gonna throw that out there right now.
A huge advocate for solo dance parties.
We can do that in pain.
Yeah, we can.
Yes, iron sucks. Alma's having a lot of issues with her anemia right now. We were talking this morning, though, and she finally got a doctor on board who is going to help get her all of her things on the right track and get her back with her neurologist, excuse me. And yeah, so I'm so excited for her.
Yeah,
It's
it's like
Brittany.
I wish like teams, like a whole team, like that could just get every single thing you need. Like that, we need that so desperately.
Yes, yes, where they could just all be together and just, you know, just find a path for us to heal.
Yes. Yeah. It's when I first got diagnosed, I was in the children's system and so it was like a complex pain team and they had an anesthesiologist, they had a psychologist, they had a recreational therapist, they had an occupational therapist, and
Wow.
really just this like whole team that hit it from every and a physical therapist. Every like single angle was covered.
Yeah.
Such a shock to move into the adult world where it's just like one person. That's it. Like that's what you got.
Yeah.
Yeah.
And hopefully that person cares.
Yeah, honestly, and like it's such a gamble and most people have to like try multiple people to get the right one.
Yeah. It's
Yeah. Were you like lucky with neurologists?
So I have kind of an interesting story. So I just found out yesterday. So kind of side note for everybody who doesn't know, I am the organizer of the 5K. So hi, I'm Jessica. I know I don't really say my name a lot, and I've been realizing that. So here I am. Anyway, all the donations, all the money I'm raising is going to be donated to the Facial Pain Research Foundation. And that is because they are the only organization that is researching to find a cure for trigeminal neuralgia, which
Hmm.
obviously has to happen.
Yeah.
They have 9 different research projects going on right now. And the first neurologist I saw up at OHSU in Oregon here is a part of FPRF, which I just found out yesterday. Um,
Okay.
yeah, so that's Dr. Kim Burkell. He did the first MVD surgery in the country.
Wow.
Um, his bedside manner is not the greatest.
Why is that like the thing? It's always the ones that like do the most surgeries that like you can't talk to.
Exactly. So that was my first experience with a neurologist. And I walked in there and he was like, oh, yeah, classic TN. Oh, yeah, you're going to need brain surgery. Try carbamazepine. I'll see you in a few months. And I was like, wait, I have what?
Excuse me?
What is going on?
I can't. Yeah, like my neurosurgeon was like that. Like it just was he knows what he's doing. He's done all these surgeries. You can't talk to him. He was kind of an awful person to talk to.
Yeah. I must say I have a great neurologist now, Dr. Juliet Preston. She's also at OHSU.
Okay.
One is in Oregon. Definitely check her out. She is such a big TN advocate. Um, she's just really supportive, and it's nice to be able to just talk to somebody and not have to explain everything that's going on.
Yeah. Yeah, that's so important.
Yeah, it is.
Have you like throughout COVID has your treatment changed? Like have you had to deal with temporary neurologists? Have you had to switch to like phone appointments?
I've had to do telehealth,
Hmm.
which is, fine for me because honestly, driving takes a lot out of me.
Hmm.
Has anything changed for you?
I haven't been able to talk to my neurologist in a year.
Oh my gosh.
Yeah, I have been dealing with this like temporary one, and I literally had to explain TN to her.
Oh
And
no.
it was like horrific, and I was just thinking like if I was in the place that I was before surgery, I would have been so screwed. Like it just I don't know. And like in one sense I trust her with my medications, like she knows my medications well and I know my medications well. I have been titrating these for years, but um yeah, I can't help but think of all the people that don't know their medications well or are new to this and don't know the information and don't have the resources. There's so many vulnerable people falling through the cracks right now. Um and yeah, it's been all phone appointments because my specialist is 2 hours away.
Oh my gosh.
So yeah, it's been kind of a mess.
Oh no.
But we're hanging in there.
Yeah, gosh, you have such a good spirit for everything that you're going through. So, um, when do you have your next appointment?
It was supposed to be the 21st, but it got moved to October 14th.
Oh my gosh.
So I'm just trying to hold it together until then because I am doing well on the dose that I am at right now. Because we tried to lower it and I'm not tolerating it well. But yeah, we will see. I'm just hanging in there for dear. Yeah.
So, what are your goals for the appointment?
Um, I'm hoping I get to talk to my actual neurologist. That's goal number one. Uh, and I don't know, just find a good balance with the medication because they upped my one medication that helps with my migraines and my blood pressure and heart rate, but they lowered my anticonvulsant for my TN. And so I don't know like if I need to maybe increase my anticonvulsant but lower a muscle relaxer or what I need to do. I just need to find a better balance where I have like enough like brain because I'm
That's
so tired all the time and I can't think clearly, but um it also gives me good pain relief. So I just want to find that balance.
yeah, I think that's what for people who don't have TN, they don't understand what it's like to be on an anticonvulsant.
Hmm.
They don't understand when you say, I can't think straight.
Yeah.
I have brain fog. I don't remember what happened 10 minutes ago.
Yep.
They,
Yeah.
they just
It's
get it.
it's so much like on top of all this like severe pain. It's like and how do you choose between severe pain and like I can't remember. I can't think. I can't do my job. I like how do you make that choice? That's a unfair position to be in sometimes.
Exactly. And then all the, emotional trauma of just living life on top of that and people not understanding you and not having good doctors and everything else. It's like, oh my gosh, I hope there are people who don't have TN that are on here that are listening and sharing these experiences, and that's who needs to be on here,
Yeah.
in my opinion.
No, I completely agree.
How's everyone doing today? I saw Teresa on here. How are you post MVD? Is it a week today? I know she was asking for some post MVD surgery recommendations if you have any.
Um, my main one is like frozen meals saved my life afterwards. We just had like we would take a day and like people would make meals and we just freeze them so it was like portioned out. When
Yes.
I would just take that out. Huge thing. Um, the ice is a big thing, just like continually icing your incision so that it doesn't get itchy and inflamed. Um, making sure you like schedule and rest if you're doing activities. Um, I made a lot of mistakes of just going really hard and um,
Doing too soon.
yeah.
Yeah.
So like if you're gonna plan something, make sure you have a couple days before to rest and a couple days after. Um, yeah, yeah, like a lot of my recommendations would be like directly after surgery. If you're facing a surgery, button up shirts. Like that seems so weird, but you're not going to be able to get like a sports bra or like a tight shirt over your head. So like button up shirts are um and then the like things that I did that I didn't need. I bought one of those airplane pillows
Oh,
because
okay.
I figured like it would be uncomfortable to lay down, but it actually rubbed on my incision back here.
Oh, okay.
So, yeah, you don't need that. Just lay on your other side. Um, and I thought I would be sitting up a lot more after my surgery, so I'd like gotten a recliner and I thought that that would be good, but because you lose your cerebral spinal fluid during a surgery, you get a lot of headaches afterwards. So you're probably going to be lying down a lot.
Okay. That's
Yeah.
good.
Yeah, there's so much. If I think of more, I will send it to Teresa, but
Yeah. And Laura has a great post on her page too. Um,
mhm.
Laura, if you want to just wave at everybody. Um, then people can know to look at your page, and you have some really good post MVD stuff on there too.
She's been such a trooper after hers.
I know. Oh my gosh. Just watching you guys post MVD. I said it last live, um, but I know I didn't save anyway. Um, you guys that have had MVD are just such troopers. MVD scares me, and I'm just so in awe of all of you and your strength.
Yeah, I don't know, it's scary. The amount of counseling I had to go through just to
Yeah.
like prep my brain for that.
Yeah.
But no, I mean, I think with everything, just living with TN, you know what you have to do, and you just do it in the end. Um, yeah, it's not really a choice. You just kind of have to bear down.
Exactly. You don't have a choice.
Yeah, yeah, it's kind of messed up, but
Melissa was saying that it's super validating hearing us talk about our experience on anticonvulsants, and it's so important to talk about the effect that they have on our memory.
yeah,
Um, Another huge thing I want to talk about that I don't like to talk about, but anticonvulsants made me depressed. They made me suicidal.
yeah,
Um, they're horrible. they're 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 anticonvulsants. They're messing with your brain. It's not normal. So if you're dealing with that and you're feeling that way and you're on anticonvulsants, it's probably that. And I am not a doctor in any way, sense, or form, so don't obviously quote me on this. But there's a lot that we're dealing with emotionally, and I want you all to know that we're here for each other. That's what this community is for, to just DM me, DM Kenzie, and just say, "Hey, I'm having a shitty day. You know, I need something. I need help."
yeah. I think I don't know. Most people I know have felt that like immediate depression from starting anticonvulsants. Like it was for me, like I started gabapentin, I think was one that really did it for me.
Yep.
I
Oh
started,
yeah.
and within the first week, like my emotions just dropped and I was having really scary thoughts.
Yeah. I got so angry on gabapentin.
Yeah. And then I think doctors, when you tend to talk about those feelings, then invalidate you a lot.
Yep.
And that just doesn't make anything better. But yeah, like if you guys are feeling that, I think both Jessica and I have dealt with that, and would love to talk to you guys.
And I didn't have, I just found out about the TN support community just a couple years ago, and I've had TN for 4 years. And so living alone essentially with this for the first half of it
Yeah.
was horrible. It's horrifying. And then you kind of start getting into the support groups, and I first started getting into the Facebook support groups, and they were great. I got a lot of advice from them, but I wasn't really reaching out to anybody. I wasn't talking to anybody. I was just kind of reading, you know, just from the outside. And then, some days when I was feeling super alone and dark and depressed, the support groups brought me even further down. And so they didn't help me in that way.
Yeah.
And so I would just disconnect even more. And it was like, trying to find somebody who knows what this pain is, knows what I'm going through. That's this community that I'm trying to create, that's already been created. Kenzie's already created this community, and now we're just sharing it and getting it out there and getting it on Instagram. I think Instagram is, just compared to what I've seen, Facebook versus Instagram, it's pretty quiet about TN on Instagram.
Yeah, I think in any community you have to find your people.
Yeah,
Uh, you're not going to get along with every single person with TN.
exactly.
That's just how it is. And I personally want to surround myself with, I don't know, like optimistic people. And obviously, we're not happy all the time. I am miserable right now, but
Yeah,
like I have the urge to be happier and to find a way to cope with this. And I want to surround myself with like-minded people in that sense. Um, but it's difficult, and a lot of the support groups, people that need support are struggling, and it's a lot to constantly surround yourself with that. So if you need to remove yourself from a support group and talk one-on-one with someone, just change your mindset around that's okay. That's really common.
exactly. And I'm not saying that that's not a good place for people to vent their, like, that's a great place to reach out. And like you said, you have to find support however it's going to support you, whether that's a big group, whether it's individually, whether it's, you know, just watching it from the outside, whatever best supports you. But you also have to recognize, hey, there are different things that are going to support me right now. And maybe it is a group, or maybe it is just texting Kenzie, or reaching out to Michaela for a funny video, you know?
Yeah, I mean, we have to do whatever we can to deal with this.
Yes,
It's a unique experience for every single person. It's like there is not one way that is the right way to deal with this.
exactly.
Yeah.
Asked what we currently take for TN. She's on carbamazepine and she's just now switching to Topamax.
Do you want to go first?
Yeah, so for everybody who doesn't know, I am currently med free. I have been on 4 different anticonvulsants in the past, not all at the same time, obviously, but I've tried different ones and I just can't tolerate the side effects. So I manage with smoking weed, CBD, yoga, meditation, journaling. Yeah. What
Yeah.
about you?
So I'm currently on trileptal or oxcarbazepine, baclofen. Um, I take propranolol for migraines and blood pressure and heart rate. And then I take another medication, pantoprazole, for stomach ulcers caused by my other medication.
Oh,
Uh, yeah, and then I take Toradol. I have intramuscular Toradol for when my pain gets bad, and Zofran for the nausea. I have tried most medications, and I was allergic to most of them or had adverse reactions like the suicidal ideation and just couldn't handle them. So yeah, like if you're on a medication, you have you have questions, whatever. I have been on most of them. um, but yeah, it's tough, and I I don't know like any two people that like find the same like
I like to call it a cocktail.
yes, I love that.
My pill cocktail is what I used to call it.
Yes, it is. It's exactly that. And I know like some people like they will be on like carbamazepine or oxcarbazepine, but they also need like a medication that's better for the atypical TN like gabapentin or Lyrica. Um, so it's all individual, and that's something you have to work on with your doctor.
Yeah, and there's so many different dosages and you know how much you need and how much you don't need, and like you said, just the right combination of, hey, this works with that. And you know, work with your neurologist. Don't give up. Medication can work for you. Non-medication can work for you. Obviously, I'm in pain right now. Kenzie's in pain right now.
Um, Elmo was asking about the intramuscular and
Yes.
my port. So the intramuscular one was suggested by my doctor. You can take oral Toradol in like pill form, and that works great. The intramuscular just kicks in a bit faster. I know it's harder to get in the States than it is in Canada, so that's one thing to consider. But yeah, you have to be taught by a nurse how to administer that, obviously. But if you ever have to go to like the ER, you can ask about that. And it does take the edge off for my pain. I don't know about your pain, but and then as for the port, like I had a port implanted in my chest for 2 years, and that was also suggested.
Uh-oh, I'm losing connection with her. Is anyone else losing connection with her, or is it just me? Can anyone hear me? Okay, so you can still see me? Oh, okay. Let's get Kenzie back. Okay, cool. Okay, looks like we all just lost you.
When did you lose me?
I heard you say you had the chest in your port for 2 years and it was recommended by, and then you cut off.
Okay. So yeah, it was recommended by my GP and my neurologist.
Okay.
I was having to go to the ER once a week before my surgery,
Okay.
get a Dilantin infusion, and my veins were collapsing.
Okay.
Um, and so that's when they decided that a port would be best. Even the ER doctors were like, please get her one. Because it was taking 6 or 7 pokes just to get a vein, and it was a mess. But yeah, it was recommended by a number of doctors, and had that for 2 years, and then after my surgery, I got it removed.
Can you talk more about going to the ER? I have never been to the ER for my TN. My
Mm-hmm.
has recommended it and has told me about the Dilatin cocktail, as she called it as well.
Yeah.
Um, but there's so many horror stories about, hey, I've been to the ER and the doctors don't know what they're doing and they don't want to give it to me. So can you speak to that?
I have definitely had those experiences. I would really recommend, if you have a good relationship with your neurologist, getting them to do a write-up
Okay.
that's, this is what I need when I'm in pain. Because just having that validation from another doctor, that has been like instrumental. I have been treated so differently since I've had this protocol written up.
Wow,
Uh,
that's, yeah.
yeah, so my neurologist specifically wrote it up in like my net care profile, and so any doctor can see that. Um, I go in there, and they are usually pretty good at getting me in quick. I live in a smaller city, so they know me. um, and yeah, I go in there, and then they usually give me Dilantin, Toradol, and then Zofran for the nausea because I puke when I'm in pain.
Okay.
Uh, but they the Dilantin is hard. It's a pretty awful medication. Um, it stops my pain in its tracks for a couple hours,
How quick
but
does it take?
it takes about 30-ish minutes to kick in. It's
Okay.
an hour infusion, and I start feeling a little bit better 30 minutes in. And then also because they give me the Toradol, that helps take the edge off as well. Um, but about 30 minutes in, I start having side effects, and it's different for everyone. But for me, um, I start having double vision. My eyes start like rolling back.
Oh, wow.
I start losing control of my muscles and my head. So like lots of times my head will just fall. I can't really stand up by myself. I can't really walk by myself. And that's also a vision thing because I have no depth perception and there's two of everything. And it can make you feel pretty sick. And it's not necessarily like a high, but my speech gets a bit slurred. My ears start ringing.
Oh
It's
God.
not fun, but it stops my pain and it lowers it for a couple days. And sometimes that's worth it.
Okay.
Yeah, it's not it's a
I
pretty miserable experience.
sound like, I the times I've read about it are in the Facebook support group. Some people say that they go and that the one thing that always sticks out to me is that they go home and eat a cheeseburger.
Hmm.
Not in pain and they can eat whatever they want.
Like it's such a the thing that gets me every time is when I walk out of the hospital and that breeze hits me and it doesn't hurt.
Oh, okay.
That's such a no matter how impaired I am, there is just something like about a breeze hitting your face and it not hurting.
Yeah. Wow. That's crazy. Thanks for sharing about that.
No, sorry, that was probably a long drawn out explanation, but
That was everything I wanted to know. Is there anything anybody wants to talk about? We have a whole list, so don't get started. Teresa has that feeling, no pain.
that it's something like you feel I don't know, it's just such a foreign feeling now to not be in pain.
Yeah, I haven't had a pain-free day in over a year.
Wow.
I forgot what that feels like.
It's bizarre.
Yeah, it is. Teresa just signed up for the 5K, which is amazing. She's 1 week post MVD, so she is all month of October. Ooh, okay, let's talk about PTSD around TN.
Hmm. What's your experience with that?
Um, man, I still think my PTSD is hanging out with people. Just people say that they understand, and uh, there's a balance between them treating you like you're disabled, um, and then treating you like you're normal, but then like sitting outside and having a drink and that wind coming, and you're like, gosh, it's a beautiful day, but I really got to go inside. But I don't want to be the one to say, like, hey, I got to go inside. It's 80 degrees outside. It's gorgeous. I just, that's my PTSD right now that I'm really struggling with is finding people that understand. And, my husband is so awesome with taking me out on adventures and then asking me the whole way, like, how are you doing? Can we adjust?
Hmm.
Um, or even he'll, feel the wind and go, okay, let's turn around and go down here. Let's go hide behind
Yeah,
here a little bit until the wind dies down.
that's amazing.
Yes. But having, just that one person makes a huge difference. What about you?
For me, a lot of my trauma comes from my surgeries.
Okay.
Um, I like after my surgeries, whenever my pain would be less, I would have so much anxiety about that pain coming back. Um, I had guilt around feeling better, which is a really messed up experience. But I just was like, other people are suffering worse than me, and that kills me inside. I had like survivor's guilt. It was horrible. But yeah, just that anxiety of like waiting for the hammer to drop, of like it getting worse again. and just waiting for it to progress again. Um, Being scared to leave the house, being scared to go out in the wind because you know it's gonna hurt. Like I don't want to go to a party with my friends because I know I'm gonna suffer afterwards. Like
Exactly.
it is that's traumatizing. Like
You're
it is messed up.
making you're making a conscious decision to exclude yourself from life and relationships and memories and events and all these beautiful things because
Yeah,
pain.
yeah, and I think even like small things, like basic things like brushing your teeth, eating, terrifying, terrifying. I don't want to do those things. Like, should I brush my teeth today? I don't know. Like, I'm terrified to. Should I eat breakfast or should I skip it or should I just eat this nasty mush again? Like, it's just it's terrifying and exhausting to live like that.
It is. It's exhausting. What has everyone else's experiences been with PTSD? I see that Teresa was saying that's where she is with, yeah, the pain coming back,
Yeah.
having that anxiety of, I honestly, I don't have that because I haven't had a pain-free day in over a year.
Yeah.
So I'm I'm living with my pain.
Yeah.
So, but I talk about that with my husband when that hope of waking up in remission
Mm-hmm.
and then thinking about that, I can't even imagine
Yeah.
over that. How do I saw you over the summer out at the lake with your friends, how do you get over it? How do you do it?
Um, I think I just can't I get to the point where like I can't stay inside anymore. And I'm like, I have to make a conscious decision of what's worth the pain because just living inside all the time is like miserable. As you guys all know, like it is miserable just to eat mush, be scared to brush your teeth, never leave the house. Sometimes you gotta risk it. Like it's just like, yeah, it sucks that you have to choose suffering over, staying inside. But I have worked extensively with a counselor to be like, okay, I'm planning these things in my life that I think are going to be worth it. And I'm going to do my best to control that situation. I'm going to rest beforehand. I'm going to rest afterwards. I'm going to make sure I have the time to properly take care of myself. But for my mental health, I need to go out and do something.
Yeah, I love that you said even earlier that what's worth the pain, making that conscious decision of, hey, this is going to help my mental health right now and this is what I need. But then also making that conscious decision of, okay, this is going to take it out of me.
Mm-hmm.
Rest 2 days before and rest 2 days after. I
Yes.
think in still that denial where I'm resting 2 days after, kind of, sort of.
Yeah.
I'm definitely not resting before.
Yeah.
And I think that's part of my PTSD too, that I don't want to accept that I am disabled.
Mm-hmm.
I want to keep doing the things that I did before.
Yeah. It's it's tough and I think it just takes time to work through that. Like I'm 8 years in and I still feel that. Like it doesn't ever necessarily go away, I don't think, but just learning how to manage that a bit better. Uh,
Totally.
and I think, like for me, I know I talked in the last live about like my suicidal ideation and my trip to the hospital. I think for so long I felt that this was just a physical health condition. I was like, Tien, this is physical. This is nothing is wrong with me mentally. But I didn't realize how much the physical pain like how much it traumatized me, uh,
Exactly.
and how much it did impact my mental health. And the moment I started taking my mental health into consideration and being like, okay, I do need to get away today. I do need this rest in my life, this break in my life, this distraction. As soon as I started doing that, like life changed. I just, like, my whole perspective on pain and happiness and coexisting with TN, like, totally different.
I completely feel that. You just have to make those decisions of, hey, I gotta get out and just get. For me, it's getting out in nature and just going out for a hike and just getting away from anything. There's no one there I have to explain anything to. My husband's there. He knows exactly what's going on. That's my sanity right now.
Yeah, I
That's
love it.
back to
Yeah.
my, like you said, and making that, once you make that decision that your mental health comes first,
Mhm.
that's how you're going to be able to coexist with TN. You
Yeah.
can't exist without it.
Yeah. Like, you can't be like, you can't fight it as much as you want to unless you're at your strongest. Like, I cope with the pain so much better when I'm rested, when I've had those breaks, when I'm nourished properly, when I'm sleeping properly. And that, like, your mental health plays into that. Like, that's such a huge thing.
Exactly. I'm gonna go up through these comments here. I know Allie said that she hasn't had a pain-free day in over 15 years.
Yeah.
That's I'm just scared of everything, and before bed, I just get so nervous not wanting to wake up during a flare. I, as many of you know that have talked to me, I haven't slept longer than 5 hours in over a year. Last night I had one of the best nights of sleep. I only woke up once during the night. And when I say I wake up, I'm in so much pain. I have to go smoke to relieve the pain and be able to go back to sleep. So I'm with you guys, the not sleeping thing.
It's like this vicious cycle of, like, I can't sleep. I'm in more pain. I'm in pain. I can't sleep.
Yeah, yes, exactly. Michaela's drinking a gross green smoothie because it's soft on her and taking. I feel you, girl. Melissa said this is one of the most validating exchanges she's ever witnessed. Appreciate you both so much for taking the energy to do this.
Thank you for being.
Yes, thank you for being here. Allie said I feel over the anxiety and unfortunately have to just carry on as it is, never going to change. I've exhausted all treatment options. That's kind of where I am too, honestly, but you know what? We're going to find a cure and we're not going to give up until we do. We're going to we're going to be pain free, Allie. Alma said, when I went pain free, somehow I tried to erase it like it never happened. But when that pain came back, it slapped me and it hurt that it's back more than anything. She said she doesn't know if that makes any sense.
Total sense. Yeah. Yeah.
Makes sense.
Yeah. When I had my surgery and I was mostly pain free, I pushed it so hard. I was like, fuck TN.
Yeah.
Like, I'm taking my life back. This is great. And I think in doing so, I didn't, like, properly heal my body. But it was like, I just need to, like, forget that this ever happened. Um, and then when it comes back, and it's a miserable, like, horrible, traumatizing experience.
Yeah. It's like this abusive boyfriend that you
Mm-hmm.
get rid of that's inside of you. That's like, it's like your body. It's your body's abusing you. It's the weirdest thing to experience and explain to other people and ugh.
Yeah. And how do you you know you have to love yourself, but how do you love yourself when yourself is hurting you?
Exactly.
Like, that's something that's so hard to wrap your mind around.
Exactly. Accepting that I do love my body. My body is healthy. My body does get me through walking and running and yoga and hiking and going to the lake and racing ATVs like Marsha and, you know, having all the babies. Like I see all these, beautiful families, it's just, yeah, Allie, it's a trade off. You want to live your life and you cope with so much pain to do what you need to make your life worthwhile. It's so true. It's a traumatizing thing that we go through on a daily basis, and it's sad that the world doesn't know about it.
Yeah. Yeah. I would never wish this pain on anyone, but like, I wish that we could make people understand how hard it is to make those decisions. Just to have that empathy, because that's so tough.
Well, and I don't think that people realize that, like, you and I are just talking about it like it's easy to, but we're also in severe, excruciating pain right now. Do you want to try to explain what your pain feels like right now?
I am getting like stabbed right here.
Okay.
Um, and like a lot of time, my pain for me, it'll start here and like shoot through the branches. I get a lot of pain into my eyebrow, and I get a lot of pain into my upper teeth. Since my surgery, I don't get as much in my lower teeth. I actually have a lot of numbness, but it is like continual stabbing.
Yeah, right side.
Yeah,
Okay. Mine's
yeah,
on my left side. And same thing, it just feels like this shooting, stabbing. It feels like razor blades in my gum right now, just constantly.
yeah, yeah. And like how it's hard to explain the severity of that because people, I think, assume that we're exaggerating that.
Exactly.
It's not exaggerating that. Like sometimes it feels like someone is trying to pop my teeth out. Like it is just devastating.
It feels like an airbag is in my gums and it's just getting bigger and bigger and bigger. And it feels like my face could explode and all my teeth would just pop out of my face.
Yeah. It's,
Like, yeah, that sounds right. Yeah.
yeah. Yeah.
But we've talked about, Kenzie and I have talked about saying that to people who don't have TN, and they're like, what?
Excuse me.
Are you okay? Like, what are you doing? You have to be exaggerating that.
Yeah. And like I feel like even when I go to the emergency room sometimes when I'm not being stabbed, I look like a normal person. And then all of a sudden like I'm screaming and they don't know what to do and then they're scrambling and finally it's being taken seriously, but because I look so normal in those in between moments, what are they going to do? They're going to have any empathy in those moments.
Exactly.
Yeah.
That's exactly why I wanted to bring up that we are currently in pain while we're doing this and talking about PTSD and, all these traumatic experiences that we're all going through.
Hmm.
Allie's saying that she has Oh, did you try? Sorry, my Siri just started. um, okay, so Allie's saying she has occipital neuralgia, bilateral TN, and anesthesia dolorosa.
Did you get that from your surgery, Allie? Because I think most people that get AD get it from surgery.
Oh, okay.
I don't know, like I don't know if it can be caused by anything else, but I don't know too much about it. Yeah.
Man, that's
Yeah.
to deal with, and no pain-free days in 15 years. No treatments, no um, we're here for you, Allie. We're
Mhm.
all here to support you. We're all know that pain. I'm so sorry that you have it bilaterally. I couldn't even imagine.
Yeah. It's I don't know. There are no words
There
for
aren't,
it.
yeah, other than we're here for you. We're here for, anybody that's going through this experience that just needs somebody. We have about 10 minutes left, so let me know if there's anything anybody wants to talk about before we go. We're going to be doing these every Thursday. Um, Let us know if there is something, that you do want to talk about. I see Kenzie having a shock right now, going through your eye. Take it easy. If you need to go get a heating pad, or do you want to just, we can
I'm
end
go-
now. Okay. I know
no.
it's so much, so I don't want to push it. And you
Yeah.
don't have meds, so let's just let Kenzie go for now. We'll touch base next week. I'm so excited for everybody that joined us. Thank you so much.
Yeah. Thank you guys so much. I I'm not feeling good today, but I just was still looking forward to this and getting to talk to the community that understands what I am feeling right now.
Yes. And you
Yeah.
hang, let me know if you need anything. If you're having a bad day, reach out to Kenzie, reach out to me. I'm in pain right now. I'm going to go smoke and take the edge off, send each other some funny memes. All right, I'll put TN friendly foods for next week, Michaela. And then again, comment what or DM me on whatever you guys want to talk about. And I have a list going here. So we will touch base on them every week. Thank you so much for joining us. Try to take care of yourselves. And I hope,
Yeah. Love you guys.
yes, love you guys all. Hang in there.